Why evidence-informed practices are needed. Informed evidence versus based on evidence. I know that all the rage is evidence-based practice, but what if we redefine the concept as evidence-informed practice? What if the evidence wasn't the be-all, end-all, but rather used to support our clinical decision-making to truly provide patient-centered care? Interested in hearing what that looks like? Let's dive in. I'm Theresa Richard. I've been a medical speech pathologist for 15 years. I'm a board-certified specialist in swallowing and swallowing disorders. I'm the founder and CEO of the MedSLP Collective and MedSLP Education. So your job as an SLP is to present the evidence and all of the available options to your patient, but not to make assumptions for them about their care. It's so important to consider all of the different emotional, mental, spiritual, cultural, social, and financial perspectives of our patients. It's our job to lay all of the cards out on the table and be open and receptive and respectful to their decisions because they may be different depending on their own personal circumstances. It's important for the evidence to inform our decisions, but not make choices for our patients based solely on this. So I recently had an evaluation for my son where a specific device was recommended based on the evidence. This was the best product on the market. The clinician said, well, based on this research, we want it to do this. Based on that research, we want it to do that. And it's just the most evidence-based product we can get for him. And I stopped her in her tracks and I said, I get that. I understand where you're coming from, but he really won't be able to use this device with all of his other limitations. So she stopped and said, I guess you're right. So we had to backtrack and we really had to start from scratch to find a device that works with his limitations and not against them, even though the research said this is what's best for him and his condition. Now, a 2011 paper by Miles and Laughlin suggested that an evidence-informed practice is considered to be more person-centered rather than focusing on just the science, which they claim has taken the humanity out of clinical practice. Imagine that. And until I actually experienced this with my son, I might have thought you were totally crazy. Overall, evidence-informed practice includes a wider scope than evidence-based practice. And as Woodbury and Kuhnke noted in their 2014 research paper, evidence-informed practice can provide more flexibility in terms of evidence sources, case studies, clinical best practice guidelines, which I think is exactly what we need for our field, where we don't have research to support every single thing we do on every single patient population. After presenting the various models of evidence to your patient while determining the treatment plan, the patient may ask you what you would do in this specific situation. And that is when it's okay to give your opinion based on your clinical experience. It's okay to say, well, based on what I know about your situation, I might recommend this. If it were me, I might choose option B because of this, this, and this. I do encourage you to give your clinical expertise if and only if the patient is really wanting it. The reason I do encourage this is that I've had so much decision fatigue regarding making decisions for my son and what's best for our family that sometimes I truly need and value the other provider's clinical experience. Some days I have to make hundreds of decisions regarding his care, and I truly do not know what course of treatment might be best or might get through insurance faster, or the distributor might be able to get the equipment faster. There's so many things that I might not know or consider that you do know that you can valuably add to the conversation. I'll be posting other videos just like this one that you won't want to miss, so make sure to hit that like or subscribe button, leave a comment, or turn on the notification bell. The last reason that I am such a fan of evidence-informed practice is that we don't have a strong evidence base for a lot of things we do in this field. Now, that does not mean that it doesn't exist or have clinical value. I was talking with a really well-known researcher in our field about an observation that I kept seeing over and over and over again on fees. And I asked him, why do we not have any research to support this? I swear this is a real thing. And he said, well, Theresa, there's a lot of us researchers that are just out there seeing patients every day. We don't have the time to run these big, large clinical studies that we want. And a lot of us really don't have all the grant funding we want to do every single project. So even though you're consistently seeing something, but there isn't a big, huge study to support it, does not discount your clinical experience at all. So this was actually music to my ears, because I thought for so long that I was crazy, that if I didn't find exactly what I was looking for in a big scientific journal, but in actuality, that is the true definition of clinical practice, and we need to embrace that. And by constantly documenting that, that actually can turn into a big research study at some point. We have a robust and vibrant community of SLPs and mentors to help you out. To learn more, head over to medslpcollective.com/enroll now.